Good afternoon, everyone, and welcome to this webinar, which is the third in the series. I am Dr. Ratna, and I work for an organization called DakshamA, which is called the Indian Alliance of Patient Groups. And this is a cross-disease patient alliance group that works for the cause of patients. Our work today revolves around stroke and stroke survival. And what we are trying to do is to raise awareness around this cause because we know that many strokes of people who suffer from stroke are unable to reach the hospital on time. And even if they do reach a hospital, sometimes the hospital is not the hospital that is stroke ready, which means it does not have the right kind of a team or the infrastructure to manage a stroke. And our purpose through these webinars is to raise awareness amongst the general population on what the signs and symptoms of a stroke could be, so that anybody who has a stroke, their loved ones are able to recognize and rush to the right kind of hospital. And also through these people, bring the matter to the notice of the concerned authorities, so that we have, stroke ready hospitals in every district and every state of the country. So with that brief introduction, I would like to welcome our two speakers who have very kindly agreed to join us for this webinar today. We have with us Professor Dr. P.N. Renjen. His introduction is so long that I think I can finish the 1 hour just speaking about his, achievements. He is a very renowned neurologist, and he has graduated from the Gandhi Medical College, Osmania University in Hyderabad, and then completed his DM in neurology from NIMHANS. He has worked on many areas that are related to neurology, but one of his specialties is stroke management. And most importantly, I would like to say that Dr. Renjen was very kind to receive me when I went and met him and spoke about the cause. And he immediately agreed to help us. So thank you, sir, very much for that kind words and for offering your hand to help us in our purpose. We also have Dr. Mohammad Rizwan Khan, and he's a professor in the Department of English at Aligarh Muslim University and has an experience of teaching and research of more than 30 years. We are very fortunate to have him with us, and he will allow us to learn from his experience of how he had to undergo, as a stroke survivor, his journey. How did he identify that he had a stroke? Where did he go to for his treatment? And then how did he manage to come out of it? So welcome both our speakers, and thank you so much for joining us. I would now like to hand over to Dr. Renjen to speak about stroke in the context of North India and the kind of challenges that both hospitals and doctors face because patients do not reach on time, and the challenges that patients face because they do not have the right kind of information to go to the hospital. Over to you, sir.
Thank you, Dr. Ratna. At the very onset, thanks Stroke Support Alliance for me to be a part of this alliance, because when she approached me, I was quite excited because anything associated with stroke excites me, and especially when it is reaching to people to increase the awareness of stroke. And I think the Stroke Support Alliances is going to go a long way in letting people know what a stroke is, because the public awareness of stroke is so poor that it is not very uncommon that a stroke patient reaches a cardiac hospital and undergoes a cardiac angiography before he has realized that he is suffering from a stroke. And by the time he reaches a stroke dedicated hospital or a stroke dedicated service, we have already lost time. We all know that time is brain. Treatment delayed is treatment denied. So the earlier you come to me, better we can help you, because we have so many new modalities of treatment That is not that we can help you in 3 hours, 4.5 hours, 6 hours, 9 hours, 12 hours, 24 hours. So the important thing is not to lose time. So in the next 20, 25 minutes, which has been allotted to me, I will talk about the important aspects of stroke from the points of view of prevention of stroke to the newer modalities of treatment available, and where is our contribution? I mean, not mine, but the place where I work, what we have done for our stroke survivors. Now you can see on your screens the first slide where you see a label ASAP, which is Apollo Stroke Awareness Program. So we run an Apollo Stroke Awareness Program. Below that, what you see is 1 in 4 of us will have a stroke. This was the World Stroke Day caption. The World Stroke Day is on October 29th. So don't be that 1 in 4. And this is what I intend telling you, that please, you can avoid being the 1 in 4. We at the Apollo Hospital, I started the Apollo Stroke Support Group. This group was started to raise a campaign of awareness that stroke is treatable and not inevitable. And we have been doing these meetings very regularly. And when we start again, I would like you all to be a part of this Apollo Stroke Support Group. After all, what is a stroke? The first and the most important question. A stroke is of 2 types broadly. 1, there is a sudden brain damage which occurs because of lack of blood supply to the brain caused by a rupture or a clot in the brain. And this is what is called an ischemic stroke. Again, please concentrate on your TV screens and you find the brain with a clot in the artery, which is an ischemic stroke, which approximately accounts for about 85% of all strokes. The second one is a hemorrhagic stroke, when there is a hemorrhage inside the brain because of the blood vessel bursting. The signs and symptoms of the stroke basically remain the same. But please remember that it has to be distinguished that you have had a stroke. Now please look at this FAST, fast. You can do it in the house. Anybody can do it. If you find that person complains of a symptom, has his face drooping to one side, his arms are drifting, he has a problem in speech, and time is critical. Get to the hospital fast. To this fast, we have added 2 more alphabets. B fast. B means balance. E means eye signs. So be fast. Immediately run to a hospital where there is stroke service. Why a stroke better? Why do you think that Dr. Renjen and his team have gone crazy? Wasn't there stroke 15, 20 years back? Why suddenly there is so much of interest in stroke? Why stroke matters? Why it matters it? It can happen to anyone, anytime, anywhere. And please remember, stroke is a common cause of disability. Not only one could die of a stroke, but one could be disabled. Disabled as far as speech is concerned. Disabled as far as memory is concerned. Disabled that he gets onto a wheelchair. That is why stroke matters to all of us. This year, 14.5 million people will have a stroke, and 5.5 million people will die as a result. 80 million people have survived stroke worldwide. Many stroke survivors face significant challenges that include physical disabilities, communication difficulties, changes in how you think and feel, and most importantly, it affects the income and social networks. If the person who earns in the house has a stroke at the age of 45, 50, or 55, or 56 years, is bedbound, how do you expect that family to survive? Please remember that the global, regional, country-specific risks of stroke in 1990 and 2016. In 2016, the global lifetime risk of stroke from the 25 years onwards was 25% among men and women. And very sadly, there was a geographical variation in the lifetime risk of stroke, with the highest being in Asia, Central Europe, and Eastern Europe. And we are a developing world. We are the people who have fought the communicable diseases. Now we are fighting the non-communicable diseases. We are fighting diabetes, hypertension, we are fighting hyperlipidemia. So we are in that world in comparison to the developed world, where the incidence of stroke is coming down, but the incidence of stroke is rising in the developed world like ours, and which is much worse in the underdeveloped countries. So please don't be one in four. Now let's tell you start from which you are all more interested. Is stroke preventable? I'm sure most of you here would not be aware of this, that 90% of the strokes can be prevented by addressing a small number of risk factors, which are blood pressure, diet, smoking, exercise. Preventing action on stroke will also contribute to a massive reduction in stroke and will contribute to global goals to reduce cerebrovascular disease, cancer, diabetes, and other significant causes of death and suffering worldwide. Now, the first thing which I would like to stress is identify. The doctor should be able to identify and treat a condition which is a common cause of stroke. A treatable, preventable cause of stroke is atrial fibrillation. Atrial fibrillation without boring you just is an abnormality in the heart, irregularity in the heart, because of which a clot gets formed and goes into the brain. So please, if you have a stroke or you are at higher chances of having a stroke, you should always look out for a preventive cause of stroke. How do you do that? Manage your weight, reduce the fat in your diet, reduce alcohol consumption, and avoid CNS stimulants. A very interesting thing, reduce your alcohol intake. Over 1 million strokes each year are linked to excessive intake of alcohol consumption. People have a notion that if I drink wine, I won't have a stroke. If I have gin, I won't have a stroke. If I have whiskey, I won't have a stroke. If you drink in moderation, keep your limit to 1 to 2 units of alcohol per week, it's fine. But if you increase more than that, you will have a high chances of having a stroke. Reduce your cholesterol. More than 1 in 4 strokes are high linked to the bad LDL cholesterol. If you have a high cholesterol, and if it is persistently high, please see that your cholesterol, the bad cholesterol, is brought down. Eating low saturated fats, avoiding processed foods will reduce your risk of stroke. If you maintain a healthy cholesterol with lifestyle changes, your doctor may or may not advise you even treatment. Another killer is diabetes. Diabetes and stroke also share a number of factors, including diet and exercise. If you have diabetes, talk to your doctor how to reduce your stroke risk, which nobody does. Exercise 5 times in a week. As I always say, modulate your lifestyle. People ask me, what do you mean by modulation of lifestyle? I say, do regular exercise. If you have diabetes, look after diabetes. If you have blood pressure, look after blood pressure. Look after your cholesterol. Over a third of all stroke happen to people who don't do enough exercise. It's not difficult. 20 to 30 minutes of moderate exercise 5 times per week will reduce your stroke rate. Eat a healthy, balanced diet. Almost a quarter of strokes are linked to poor dietary habits. Eating a diet high in fresh foods, vegetable, reducing consumption of processed food will reduce the risk of stroke. Half of the strokes are linked to high blood pressure. Please don't become a doctor for yourself and say, I don't have blood pressure, so I don't require treatment. Knowing your blood pressure, controlling it, it is not essential that you control your diabetes and blood pressure by medicines. But as I always say, controlling them by lifestyle changes will help you to reduce the risk of stroke. Stop smoking and avoid smoky environments. Almost 1 to 10 strokes are linked to smoking. Smoking will reduce your risk of stroke and the risk of people who live with you. So please remember one thing. A passive smoker is as much as the risk of a stroke as you are. So please don't harm yourself. and harm the people who are around you. Maintain a healthy weight. How will you maintain a healthy weight? Do exercise, good diet, and maintain a body mass index, which will help you to reduce the incidence of stroke. Worth stressing that strokes and depression, there have been studies where almost 1 in 6 strokes are linked to mental well-being. So managing depression, anger, anxiety are important in reducing the strokes of risks. Now, I think I have been able to tell you the preventive factors of stroke, the modifiable risk factors of stroke. Unfortunately, if you get a stroke, what can we do for you? That's what I said when I started. That time is brain. Treatment delayed is treatment denied. Now, as I just said in my initial opening remarks, that we have the ischemic strokes and we have the hemorrhagic strokes. Now, ischemic stroke, if you come to us within 3 to 5.5 hours, 4.5 hours, I have a drug which is called TPA, tissue plasminogen activator. And I can give you this drug and I can dissolve the clot. And interestingly, 30% will make an excellent recovery at the end of 3 months. What fantastic thing it is. Okay, doesn't matter. If you have even crossed 4.5 hours, do come to us because we have clot removing devices. We have clot retrieving devices. Within 6 hours, if you come to me, I can retrieve that clot by these clot retrieving devices. Don't worry. Even if you have crossed 6 hours, we have now sophisticated imaging to 9 hours, 12 hours to give you drugs to improve your quality of life. So, my dear friends, we are extending the time so that more and more patients are benefited. Even if you've had hemorrhagic stroke, you need to go to a hospital immediately because we can remove the hemorrhage, and by chance, if you have an aneurysm, which is a balloon dilatation of the artery, we can clip it and coil it and practically cure you. Now, what is stroke recovery? It's a solid misnomer that if you don't recover in first 15 days, you will not recover. If you don't recover in first 30 days, you will not recover. If you don't recover in first 6 months, you will not recover. This is one nonsense. 10% of stroke survivors almost recover completely. 25% recover with minimal impairment. That means they got back to work. 40% moderate to severe impairments. 10% require skilled care and 15% die. So even if you take this statistics which I am giving you, about 40 to 40%, 5% of patients make a reasonably good recovery to go back to normal works. How do we do that? We do that by an integrated rehabilitation program. As I always say, rehabilitation is not only physiotherapy. Physiotherapy is one part of rehabilitation. We have physical therapy, which is walking, range of movement. We have occupational therapy, which is taking care of oneself. We have speech therapy, increasing your communication, increasing your swallowing difficulties, and improving your memory. And in the end, we have recreational therapy, where you enjoy what you do. You cook, you garden, you play. So if you do all this, it's a total rehabilitation of a stroke program. The lifestyle changes for survivors and caregivers. Please don't have an attitude that if he has had a stroke, I can't have it. I don't want you to be with the 1 in 4. And you can avoid that 1 in 4. We have to tell the survivors about daily living skills, dressing, nutrition, skin, pain, sexuality, behavior. They're all depressed. Emotional lability, which is a part of stroke. They neglect one half of the body, their memory and communication problem. So managing a stroke is not only giving PPA, it is also beyond that, till the time you can get back a patient to his activities of daily living. Now, these are the devices. What fantastic 2015 was a change in neurology. We had these devices where we could remove the clots. I love showing this picture. And I would request, just see the first picture is a CT. We do an angio, our TPA is ready. We do a CT perfusion MRI. We do a preoperative ESI, and you can imagine and see that the artery is totally occluded. We do the thrombectomy, the artery is open, and you can see the post-op DSA where the artery has totally recanalized. So this is what happens in our hospital. We have a code fast. As soon as the patient enters the hospital, there's a code fast. We have a group on the WhatsApp. Everybody's informed that there is a stroke, so that no times are wasted. And in time, patient gets his angio and the clot is out. So, ladies and gentlemen, 1 in 4 of us will have a stroke. Don't be the one. Come and join us for the Apollo Stroke Awareness programs. And I'm sure that Dr. Ratna, who is also has a passion for this, we would be able to deliver, increase the awareness for our people of stroke. This is my unit. I cannot do everything myself. I always believe that management is a team effort. Dr. Renjen is superfluous. He has to have a team. And a team has to function like a team. A team has to function for the benefit and the goodness of the patient. Recently, we were given the Global Association of Physicians of Indian Origin Award for our innovations in stroke. And recently, I have been awarded the Distinguished Researcher Award by the Apollo Group for my outstanding work in stroke research. What we could do in our own way, we've had a stroke channel on the YouTube, which is called Stroke Neurology, and we have a large number of informative lectures on this. So please, if you get the time, type Stroke Neurology PM Renjen, you will get. And this is what we did last year. We called a stroke awareness walkathon. we had about 500 people who walked from Apollo Hospital and took a plea to know stroke, prevent stroke, and see that how we can prevent stroke in our community. So I can only say thank you very much. You've been patiently hearing me. Keep calm, love neurology, love stroke, have passion for people of stroke. Look at them as people who are suffering and look at them how you can get back them to their normal quality of life. Thank you very, very much for a patient head.
Thank you, sir. Thank you. And I love that small caption at the end, which says, I am a neurologist to save time. Let's just assume that I am right. I think that saves a lot of time. Thank you so much. Some very, very startling numbers, which even I wasn't aware of. 14.5 million will have stroke, of which 5.5 million will die. And these are all preventable deaths if we manage all those risk factors that you just, alluded to. What is even more important is that most people, 50% of the strokes are linked to hypertension, and hypertension is easily managed. But many people think that once their blood pressure is in control, they can leave their medications, and they say that we don't feel sick anymore, and they stop their medications, and that leads to a lot of problems, including stroke. I have a lot of questions for you, but before we come to the questions, if you can still give us another 20 minutes of time, I will go to Professor Rizwan. Otherwise, we can have the questions with you if you would, if you're busy and you have any patients waiting. Would you
Yeah, I
be?
can. Professor Rizwan will take, how long will it take, Dr. Rizwan?
I think 10 to 12
Okay.
minutes.
I like to hear Professor Rizwan.
Okay, thank you so much. So over to you, Professor Rizwan, and we await to hear from you. Thank you so much for joining.
Okay. Let's go. Okay. Very good noon to everybody. Um, uh, this is Rizwan from Aligarh Muslim University. I recently had underwent this brain stroke, and I would like to share a couple of things. Number one, I was never, educated on about this the phenomenon of uh, uh, brain stroke. I didn't know. I didn't know actually, to tell the truth. Since Dr. Renjen is there, so I would like to say that so much of things are there, but I didn't know. Being in a university, and I never knew about these things. So it was a very strange and very so it was you can see the timeline here. We changed it. So what happened at 3:30 in the noon. uh, I got a slight hinge in my right hand while I was in my office. So I didn't know, because it was within a fraction of a second. This thing, my hand went like this. I thought that it is something, and I continued with my office work. Then I went home in the evening. I went for um, so many things, evening walk and everything. By 2 o'clock at night, I got a vomiting, and after that, I thought that okay, now it is just a vomiting. I will get a nice sleep now, but that's not what happened. At 2:30 o'clock, I got something in my stomach. I went to the kitchen. I boiling water, and that time exactly what happened is I got a certain something inside, and I thought that something is going to happen. What exactly happened is that I'm 5'11", and I could find myself going down like this. I did not turn like this or right side or left side. No, I ऐसे जैसे कि आपके अंदर से हवा निकाल दी गई हो और आप बिल्कुल वहीं के वहीं आप जाके पड़ गए बिल्कुल. And my mind was starting working. I thought, what is this? What is this? What is this? And instantly I became unconscious. And this what happened in my kitchen. And at that time, 2 o'clock, everybody was asleep. I was there, my wife was there, and my son was there. I didn't know what will happen, but I remember that at 3:35, 3:45, I could feel that I'm back. So I went to my wife, I woke her, and we went to the hospital, which is our university hospital, which is just 15 minutes from my office, from my house. So that is how I reached our local hospital. So we reached at 4 o'clock, and there we took 2-3 hours and basic treatment, and 7:30 we started for Apollo. Day one was like shock, fear, because I two rounds of unconscious I got through. So it was traumatic night. I reached when I reached entered Apollo. I remember at somewhere, I don't know the place, but I could feel that there were Dr. Renjen and Dr. Kamal and Dr. Dinesh were there, and they were, waiting for us, and they investigated things over there. Day two was basically testing and investigations, and they could my familiarity with other staff and doctors, and I was day three. I remember I could see that they were doctors were very happy with my condition, improving condition, and they could feel that there is they had ischemic I think in my case they had ischemic clot, and they suggested me for stunting. They suggested me for stunting because 90% of my carotid artery was blocked, and so they said that you have to go for angiography, and you have to do the stunting there. They started my therapy, and I started on the third day. I started speaking also, and I started walking also, and but I was not able to speak legibly in a right manner. One thing I would like to say that I started reading the newspaper that they got in the in our chambers in the hospital, and I could started getting talking to people. I started getting what I maybe I was not able to speak, but I remembered everything. It was there in my mind, but it was not in my lips. When I speak, something will happen, and something it will go otherwise. But actually, in my mind, when I see somebody, I know that this is the person, and I know his name also, but I was not able to speak. It was a very funny situation where I was in and very I had mood swings. It was very funny and very painful for my colleagues and my people, because they could suffer me my mood swings at that point of time. No problems. आगे चलो. No problems. So there are a couple of things I would like to share with you. This is very important. One thing was in my mind, in my brain, I had right language. When somebody comes, I will say, okay, so, some visitor is there, I will say hello. But when I speak, it will not come hello, it will come something else. So the mind and the here, there is a mismatch. So something like Sarai Kale Khan, it's a street in Delhi. One day my wife came, and I asked her that what happened with the doctor. She said, about what? I said, about Sarai Kale Khan. So they started, they were amused. So I kept repeating what happened about Sarai Kale Khan, Sarai Kale Khan, Sarai Kale Khan. Actually, it was about stunting. And the discussion that I had with what was that? No, Nishchint. Nishchint Jain, who did my this thing, stunting. So I had likewise I had one samosa, oximeter, that is put in the hands. That was called samosa. So I know that this is oximeter, but when it comes here, you don't know what's going to come. So such type of things. Besides that, there were my Shuddh Hindi, Shuddh Urdu, Shuddh Farsi, Shuddh Sanskrit, and Shuddh Arabic were coming out of my mind, out of my mouth. I didn't know how. Certain words that I used in Sanskrit 20 years back, those words were coming to my mouth. So that type of things were happening. Yeah. So while doing my stunting, I realized that I am talking to the person who was available there, that how good is Urdu matching with Turkish language. And I was very comfortable in talking to him, that how good. So what happens is that I can't say. I'm amazed often that something like that is happening in your life. So there are certain things. There is one point which is very important, that there was a time in what is that called? after the hospital, after stunting, they ICU. You know what happened in ICU, that the nurses, they thought I said something. They thought that I'm saying something which is out of the blue. I'm not saying something, normally, but actually I was speaking it out of normal, behavior. But they took it as abnormal behavior. So that type of, and they came, two of them came to me, and they came and looking like this, and as if I'm abnormal. So that type of, things are very important to be understood there, that look at here, there is a patient, and you have to treat him first as normal, then abnormally. Besides that, anger is there, and those things are there. I'm very much grateful to the doctors, and I still remember the care, the words of wisdom and encouragement that helped my family and me, and Dr. Renjen's, he's you know I have seen him, doing wonders in his brief and small comments. So those points are very important. Follow-up checkup I am doing with Dr. Renjen, and I'm sure that very soon I will be, of course, scientific advancements are there, technological things are there, and certainly, Apollo is one of the best hospital in Delhi. I would like to tell you that I have stopped smoking. It was I don't know, since 1984, or since 1984 I have been smoking, and that I have stopped. But besides that, exercise, walking, they were regular with me for the last 5 years. Since 2015, I have been walking and I have been doing exercise. I think those things must have helped me here, but I'm sure very soon I'm thinking of joining my time. I'm sure there are certain pangs of anxiety or hope, but I'm sure that my positivity will take care of those things. Small queries are there. During my investigation, was my heart checkup was done? This is one thing, and this is another thing. Or how long this stunting last? How long this stunting last? These are two things. I will certainly like to thank, besides my wife, Naz, and my children, Farhan and Asia, and my son-in-law, Qubat, for their maturity and for their care in the whole. But besides that, I had many of my relatives there, and many of my friends there in Delhi, and they all came up, and I know that I didn't know what type of person I am, but after this stroke, I have got many kind words from my friends and my family members, I'm happy about that, and I wish them all the best for uh, their themselves. With these words, I would like to stop. You must have seen that I have improved in my speaking, and it is just 1.5 months, and I'm writing also nowadays. I have done this cursive writing. If you can see, I don't know if you can see, and you can see my coloring these things, and so I have made special efforts for my you know reading and writing and speech therapy, and this is where I am right now. I hope to join my services very soon, within a week, inshallah. Thank you very much.
Thank you, Professor Rizwan. That's an amazing story, and you have really done well considering that it's only 1.5 months, and we hope that you will recover completely and are in that top 5% or 10% that Dr. Renjen mentioned, who almost have a
Yes,
complete recovery.
yes.
So before I ask any questions, Dr. Renjen, maybe you would like to ask the two questions that Professor Rizwan raised. One is, was his check for the heart done to see if there are any problems or any risk factors there? And the second is, how long does a stent last?
Both the questions I'll answer. Professor Rizwan, the answer to the first question is that every patient of stroke, his heart is looked into
Yes.
because it is the heart-brain axis.
Mhm.
And if you see my slides when I showed you, I was talking about atrial fibrillation. So every patient of stroke, as a routine, has a 2D echocardiography, and they also have a Holter to look at any arrhythmias in the heart which could be responsible for the stroke. Number one. Number two, Dr. Rizwan, in our own experience, which is a very huge experience of angioplasties, if you take your medicines regularly, your stent will not get blocked. The maximum I've seen one patient, I did an angioplasty 15 years back. He regularly comes to me for follow-up, and once in a year, he does his carotid Doppler to see the patency of the stent. So
Okay.
please don't worry. You look after your health, look after your lifestyle changes. It's great to learn that you have stopped smoking
Yeah.
and continue your antiplatelet agents, and rest we are here to take care.
Yeah.
Thank you, Dr. Renjen. Another
Thank you.
question related to the stenting is, stenting itself has its own risks. So how can those risks be minimized?
Well, ma'am, there can be no procedure which doesn't have a risk.
Yes.
And you always have to see a balance between the risks involved and the stenting procedure. After all, if you have a vessel which is 90% occluded, the chances of this vessel getting totally occluded and totally forming embolization in the brain is much higher than the complications of stent on the table, which is in 2% of patients. So yes, we take all precautions when we do a stenting procedure, precautions of embolization, precautions of patient developing hypotension, patients developing some sort of what is called bradycardia at the time of the stenting.
Thank you, sir. And then I had a couple of questions. You mentioned some very startling statistics about the global burden of disease for stroke. Does India have a national registry for stroke?
Unfortunately not.
Okay.
We
Okay, so
don't
that would be one area where probably we can work as an advocate.
most of the information you get from registries.
Yes.
You've got a very famous trial, which is called the Flabbingham Trial. which is you get so much of information, you learn so much about the disease pattern. And after all, the disease differs in India and the other part of the world.
Exactly.
We are a different race by itself. I
Exactly.
am not an American, I am not a Britisher.
True.
I get more of arteries involvement inside the brain. They get more of extracranial stenosis, what Professor Rizwan had. So yes, we don't have a registry. I'm unfortunate, but you know, there are a lot of registries abroad which have given us some very valuable information.
Thank you. Now, Professor Rizwan was very fortunate to be in Delhi and reach a hospital that had all the facilities.
Yes.
If the person is in a village or a tier two city or a small township, what can the person do to be able to get this, benefit of 4.5 hours or 6 hours or whatever it is?
Well, Professor Rizwan, the benefit you can get one, if you have a stroke, plain simple CT scan, see if it's an ischemic or a hemorrhagic stroke. There is absolutely no harm giving a tablet of 150 milligrams of ecosprin.
Okay.
There is absolutely no harm, even if it's a hemorrhagic stroke or an ischemic stroke, giving statins. There is absolute harm in bringing down the blood pressure. So I think if a person sees a stroke, what he can do straight away, do a CT. CT is now available in most of the parts of our country, at the district levels also. Do a CT, give a ecosprin, give a statin. If you have the facilities, give TPA. If you have the person who can do it, then send him across to a center where there are complete stroke facilities available.
So if a person had to look for information on where a hospital is stroke ready, is there any central database or any information which people can look up?
No, really not. I mean, it's not that a person sitting in Agra can just type in, say that I want stroke survey hospitals. They will not. There's no information like that available on the net. It is only by the word of mouth. Professor, I would say, so Professor Rizwan's case, he was referred to us by the professor of medicine at the Aligarh Medical College. So, it's like that.
Yeah, so that there is a huge need. The other question that follows from this is, would you say that primary healthcare doctors or doctors who are doing, single hospital or two or three hospital practice would be aware of the signs and symptoms of stroke and would be able to detect within that golden hour or golden three
Well,
hours that?
Dr. Ratna, this is what I'm trying to do. This is what is to make everybody. That's why this came fast came. They added two more alphabets to that. So
True, true.
that's what is to make people aware of stroke, mini strokes, TIAs, and be fast.
Thank you, sir. I think there's a lot more work that we need to do, and I'm really grateful that you have given us your time today. There are a few more questions. One is a general kind of a question. Is it a myth that frequent cold water baths can lead to stroke?
Well, I won't say that, but I would certainly say that extreme temperature makes the blood thick and there are higher chances of getting a clot.
Okay. Then another question, and I know that Apollo Hospitals is involved in a lot of clinical research and trials and other stuff. But in terms of research that is available for populations of this country, do you think there needs to be much more done, or are we already doing enough research that is indigenous to our populations to gather clinical evidence on
We
how
are
to
doing,
treat patients?
we are doing, but much more needs to be done.
Okay. Thank you so much. Thank you. And the other question that many of the patients ask is, I know that Apollo has a system where once the person is discharged, you put them into rehabilitation and therefore there is a follow-up. But in terms of stroke care in India, if hospitals do not have that facility within their system, is there some way that the patient can get to know that knowledge of where to go for, say, speech rehabilitation or occupational therapy or recreational therapy? How many hospitals would have everything under one roof?
Again, no. I'm sure most of the hospital just talk about neo rehab, just talk about physical therapy. Physical therapy is one part
Exactly.
of everything else. So you require a total neuro rehab, which would, as I said, advise occupational therapy, speech therapy, this therapy, everything else.
Uh, Somebody is asking a question. If there is no CT scan, what can a person do?
Well, then you can't treat a stroke. To be very frank with you. You can still give aspirin. You can still give statins because even if it's a hemorrhage, you may not do much harm to him.
Okay.
So even if you don't have a CT, record his blood pressure, give him an ecospin, give him a statin.
I think that message needs to go out loud and clear. Most people would not touch a patient if they think that they do not have a neurologist, because we have heard this time and again that patients reach a hospital and the hospital, keeps them for 1 or 2 hours and then decides that the person may have had a stroke, and they say that you need to be referred to a hospital that has a neurologist because we do not have one. And by the time the person reaches the next hospital, it's beyond the golden hours, and therefore they have lost precious time. So I think a lot more needs to be done to just educate doctors and hospitals that what you said as a basic treatment can be immediately given, so that the patient doesn't suffer more harm than what has already been done. There's one question that has come from COVID-19, and it says that COVID-19 has helped, advancement in digital technology. So can digital, say, telemedicine or telehealth be used for early diagnosis of stroke and maybe some part of the management? We know that stroke cannot be managed without a hospital, but at least some part of it.
Quite right. Telemedicine has gone a long way. Suppose anybody has a stroke sitting in a tehsil or something, and he has a telemedicine program. He talks to us and he sends us the film. We tell him what he's supposed to do. So yes, that is telemedicine is a very important role to play. There's no doubt about that.
Okay, so telemedicine can help in terms of referrals and okay.
Absolutely.
Thank you. And then there's one question where a person is asking, using too much screen time, using too much of mobile or TV or laptop, can that lead to stroke?
Not really. I don't think so. That is the cause of stroke. But I suppose the only thing is, as we just said, stress, anxiety, depression, all that. But I don't think that there's any correlation between that and stroke as yet.
So the last question before I close and thank both the speakers. Does Apollo already have awareness materials that can be distributed?
Well, yes, and we can even develop more. See, that is what I'm trying to do. That's what is to increase stroke awareness by giving people reading material so that they appreciate, first of all, they appreciate what stroke is and not appreciate what happened 30 years back and have a nihilistic approach against stroke. The nihilistic approach to stroke has to become a positive approach. That is what we are trying to do. We got to
Yes.
think, yes, we
Also,
can,
I think we need to develop our emergency, medical system where the hospitals and ambulances are linked together so that we have
yes,
these corridors where patients can be transported in the shortest possible time.
that's right.
Thank you, sir. I think we are over time. There is one last question. What precautions should be taken after the age 50 in order to keep the neurological system healthy?
Well, I think, again, I say the modulation of lifestyle. What you should do, look after your diabetes, the pressure, look after, do regular exercise, and most importantly, utilize your brain. You will not develop dementia.
Thank you, sir. Thank you. With that, I will, close the session. We are 5 minutes over time. Thank you so much to both the speakers. It was really, really very, educating. Everybody learned a lot. And Professor Rizwan, you have been very, very motivating. I mean, after hearing your story, I thought, okay, you've lost 24 hours and nothing can be done. But the miracles of medicine are such that you reached the right hospital and you got the right
Yes.
interventions and you've been able.
I'm actually very much thankful to my wife, because it is she who took up this decision that we should go to Delhi.
Yeah.
And we reached Delhi in 6.5 hours. I mean, from 4 to 11. So that's very great. I mean, I could understand it only later on, that how important is these 5 years, 5 hours and 6 hours. So thank you, Renjen sir, for your polite words, and thanks, ma'am, Ratna ma'am, for your kind words. I'm benefiting now. Earlier, I was not at all, into these things. So I have really benefited myself.
Thank you, Dr. Rizwan. Thank you for your effort.
Thank you. Thank you, sir. Thank you very much. And we will keep in touch. And a recording link of this will be shared with the audience. Thank you, everyone. Thank you, sir.
Thank you.
Thank you. Thank you, sir.